So I'm confused, Dr. McNamara. You really are an advocate for gender-affirming care, and what I'm hearing from you and other speakers is this is healthy for people. It's healthy for mental health. It's healthy for them in general. So why would you not refer a minor for surgical sex-affirming surgery?
You know, I also appreciate this question because it lends insight into the shared decision-making process. I've never referred a patient for surgery because the patient has never desired surgery who I've cared for. It's all about what the patients want, how that fits into the informed consent model, and how that is, and how that goes along with clinical practice guidelines.
So, I'm sorry. So what age group are you seeing? I think up to 25 or something.
10 to 25.
Yeah. So no age has any of your patients desired to have surgery for their mastectomy, a phalloplasty, a phallosectomy, none of that.
None of my patients have desired that surgery at that moment in time. We discuss openly.
Okay, so again, if gender-affirming care is what's proper, why have you not recommended that surgery?
I think what I'm trying to say is that I haven't recommended that surgery. I haven't helped facilitate it because none of my patients have expressed a desire for it. That's my
right. But I'm an oncologist. Patients don't come to me requesting desire for chemotherapy, but I recommend chemotherapy because that's what's best for them. So as a physician, if you think that gender-affirming care is best for your patients, why have you not recommended surgery on any of your patients?
Gender-affirming care does not equal surgery.
I understand. There's a continuum.
Dr. Herber's in the call, please. We need to have some quorum here, so we'll appreciate if you do not do those actions at this point in time. Let's have an intelligent and cohesive conversation, please.
So, Dr. McNamara, I understand there's a continuum of puberty blockers, sexual sex hormones to change the sex, and surgery. And what we've heard from all the other experts is that there's this whole continuum is part of gender-affirming health care. So do you think that the surgery is part of gender-affirming health care or not?
I do think it's part of gender-affirming health care for some individuals.
Okay, but you don't recommend it to anybody, is what you just said.
That is not an appropriate characterization of what I said. I have not had a patient who has expressed a desire for it in my experience.
Again, they may not express a desire, but you as a physician make recommendations to patients based on what you think is best for their overall care. So you have never made the recommendation. Just want to get that on the record. Did you hear me?
Yeah, I have. I can hear you.
Yeah. So are you going to answer my question or just not?
Oh, I'm sorry. Did you ask another question? I promise I hear about 50% of what you say.
My question was, have you ever, as a physician, we recommend treatment to patients based on our judgment of what's best for their care. So you have never, and so in the continuum of gender-affirming health care, surgery is part of that. Have you?
Yeah.
And you just said, and so I'm asking you, have you ever recommended surgery to your patients?
I don't tell anybody you need surgery. You should get surgery.
Okay.
That's not how gender-affirming care works. Physicians don't tell patients what they should do with their bodies or their gender expression.
I understand. As an oncologist, I don't tell them I give my recommendation as to what they need. So just answer the question, yes or no. Have you ever recommended surgery for your patients?
I have. I wonder if maybe we're disagreeing on the definition of recommendation.
Okay, I'm done. Thank you.
Okay, Dr. McNamara.